This is Eitan Shalom. I am at the Body Mind Wellness Center. I'm going to bring you into the treatment room now and show you a little bit of what I'm doing on my patient with low back pain, chronic tight muscular low back pain without any disc involvement. And so we're going to walk into the treatment room now, and I'm going to put the camera down so I don't show you my patient's identity. And here's what we're doing. So she has chronic low back pain, and I have done something very interesting. I've done dry needling of the aponeurosis of the abdomen, and aponeuroses are deep fascia that attach sheet-like muscles together. They can attach muscle to bone. They act like tendons. They can attach muscle to bone. They can also attach muscle to muscle. We have them in different parts of our body. We have them in our hands, and in this case we have it on the front of our abdomen where the rectus femoris, the rectus muscles attach, and also the obliques. And if you look at an anatomy text and you look at the body without the skin, you'll see a big white sheath. That's the aponeurosis. And so this person has chronically tight low back pain, chronically tight low back muscles with pain after a car accident, and no numbness or tingling or pain down into the legs. And so I have needled, I've done dry needling on a series of points, because this is what's interesting is that when you relax the abdominal muscles, it also helps to relax the back muscles. If you were to try this at home, just tighten your abdominal muscles together, just do an isometric contraction, you would notice your back tightening up a little bit. And so when we relax the muscles of the abdomen, it helps to relax the low back. I have combined that with dry needling. It's a different sized muscle. These needles here are actually 3-inch needles, because you have to get through a fairly large amount of fat to get to the aponeurosis and the muscle underneath it. And these I've done on both sides the iliacus muscle, which is part of the iliopsoas muscle group. And the iliopsoas muscles originate on the front of the spine. So when those muscles are tight, then it pulls on the lumbar vertebra, and then the muscles of the low back have to contract to try to pull back. Because I also do acupuncture, I have also done a couple of acupuncture points. It's my philosophy that always treating the whole person is better than treating isolated muscle tissues. And that's how I do dry needling. I like to needle the whole person. So in this particular case, I'm not going to... Can I cover your eyes and show? Yeah, so she was very stressed out when she came in and having trouble relaxing. And she actually asked me to do this point because she's experienced with it. It's this acupuncture point up there called Yin Tong, which has a very immediately calming effect on the nervous system and the mind. As soon as I put that in her, she was able to relax, and that made it far easier to needle these points. So why wouldn't I do that? I don't believe in just doing dry needling on the one muscle that hurts. I like to treat the whole person, and for the same reason I did these 2 points here, San Yin Jiao. These are acupuncture points that are also very relaxing, and they open up the flow of what we would call yin, which is nourishing energy, up to the upper part of the body. So again, they function as points that are very, very relaxing. So I'm going to take these out now. I'm going to put the camera down in a second, but I want to just show you. This is the method of, I forget what physical therapists call this, lifting and thrusting, where you pull the needle out a bit and then put it back in. Take a nice deep breath. There we go. And so that, did you feel that move? Yeah, so that's releasing this a lot more than it was. Normally I would use two hands, one to steady the needle. There we go. You okay? Yeah, and you can see that this is a little bit challenging, so you have to help people breathe through it. And same thing with the iliacus. I want to get a little bit of release. There we go. And that's called the muscle twitch response. When the muscle twitches, then you know it's lengthening. So that's it. I'm going to turn the camera off now. I just wanted to show you that. This is Eitan Shalom at the Body Mind Wellness Center. Thank you for tuning in. And thank you to my patient.